I have a beautiful wife, and I'm a proud grandparent of 8 beautiful grandchildren. I was a line haul driver for 16 years, and I had to give it up because I had a heart attack. I had a cardiologist assigned to me, and he discovered that I had a congestive heart failure.
His first LVAD got infected, and he had a second one. The second one did get infected eventually, and the feeling was this is just going to keep happening. He was at another center at the time, and the feeling there was that he was too high risk for transplant. Therefore, his cardiologist called me and said, would you consider evaluating him? So we evaluated him, and we agreed he was a high-risk candidate, but we felt with our current program that we could take that risk. And so we accepted him onto our list for transplant.
Kindred got involved with Baylor and everything, and they worked together.
He actually was at Kindred before the transplant getting IV antibiotics for his LVAD infection.
He was motivated, he was happy, he was moving around.
We work on strengthening, we work on endurance, and we also work on balance. Anything to keep them up and going and active and strong for their transplant.
It was 3 months later that I received a call that they found the perfect match for me.
He actually got his call that he got a heart here, and so the staff got to celebrate with him. He came back to Baylor for his heart transplant, and it was truly, as expected, a very difficult surgery.
I had such a good surgeon. He worked extra hard.
Initially, after the surgery, he was doing very well. His heart was great, but as the infection that can't be physically removed at the time of surgery seeded the bloodstream, he became very, very what we call septic, which required a lot of IV drips for blood pressure and a prolonged ventilator support, and that results in the deconditioning that requires an LTAC facility. They'd already taken care of him before the transplant. They knew him, they were invested in him, and it only made sense to return to the team that got you there.
We work in partnership with Baylor so that we keep the cardiologist in the loop. And then Mr. Dixon is a classic story of how everything worked together to help him.
All of our transplant team easily got the privileges here, and we round and see patients very easily here. And I think that's important, that the continuity of the original medical team who took care of the patient at the beginning and is going to take care of the patient afterwards is allowed to be involved in the care here.
He was extremely sick. He had, multiple incisions, he had infections, he was confused. So it was difficult seeing him from one aspect to the next and trying to get him back on the right road.
And our purpose was to get him through that period of time and keep his strength going, keep him motivated, and looking forward to his new life.
The people at Kindred are the ones that helped me through and helped me through recovery. I couldn't have done it without them.
One day it just completely changed, and he was like, I'm motivated, I want to get out of here. You guys work so hard, and I want to do this for myself, my family, and for you all.
I consider everyone my family. I've cried with them, I've hugged them, squeezed them, and they're just family to me.
This is a piece in the continuum of care. So you have your acute care hospital where he got his transplant, then he comes here for the prolonged high-level support. And once they have strengthened him to the point where he's not on a ventilator, where he's able to participate in exercises, then he's ready for what we call inpatient rehab. And that's when he returned to the Baylor Institute of Rehab and was able to participate. They have to be able to participate in at least 4 hours of rehab a day. That's cognitive, speech, physical therapy, everything to get totally back to able to function in the world.
I'd made a goal to go home, and I worked with the nurses and they worked with me, and that was where I went home. I'm looking forward to just enjoying life and taking it one day at a time.
It's almost like he's got a new lease of life, so I'm happy, excited, glad to see that, and hope we can provide the same for many more patients.
I think it's just important to think about LTAC facilities.
It's just a special placement. If I had to do it all over again, and I've got a friend right now that's got an LVAD, and he's wanting to switch to Baylor, and I told him, whatever you do, you go to Kindred.